Welcome to the podcast from the Fabian Society's Alan Johnson Lecture.
Thanks so much, everyone. I'm Sanjay Katwal, I'm General Secretary of the Fabian Society. Welcome to tonight's lecture, part of our Progressive Manifesto series. And I'm particularly pleased to be joined by the Secretary of State for Health, Alan Johnson, in this, of course, the 60th anniversary year of the NHS this month, and a very proud moment that for the Labour Party and the Fabian Society. Ladies and gentlemen, Alan Johnson.
Thank you very much for being here. I wanted to ensure that I made at least one speech to the Fabian Society in the 60th anniversary year of the NHS, recognising the crucial role that the Society played in the establishment of the NHS. The introduction in 1948 of universal healthcare free at the point of need is without question the finest achievement of a Labour government. It was first proposed nearly 40 years earlier by Beatrice Webb in her minority report to the Poor Law Inquiry of 1909. In more recent years, the Fabian Society has continued its campaign for better health for all, leading in the debate on tackling health inequalities and focusing particularly on the importance of early intervention in infancy and childhood. The NHS is, I do assure you, in the rudest of health as it becomes eligible for its bus pass and its winter fuel allowance. The decades of chronic underinvestment, perilously long waiting times for life-saving operations, and a crisis every winter are becoming a distant memory. So with the resources and the capacity in place, we're now ready to move to the next stage in the service's evolution. Aradazi's review set out how we will make quality the guiding principle in all we do, and how we will tackle prevention, as one strategic health authority put it, on an industrial scale. The review was shaped not by central dictation, but by the vision and expertise of thousands of clinicians across the country who identified the challenges they face today and what needed to be done to address them. Now, I want to focus this evening on obesity, which is the biggest health challenge we face. The Foresight report published last October looked at the question of how we could deliver a sustainable response to obesity over the next 40 years. It assembled the expertise from academic disciplines as diverse as epidemiology, food science, genetics, psychology, and sociology. Its conclusions are stark. Today, 2/3 of all adults and 1/3 of all children are either overweight or obese. By 2050, on current trends, these figures will rise to almost 9 in 10 adults and 2/3 of all children. By then, obesity, which is already responsible for 9,000 premature deaths every year, 58% of all type 2 diabetes, 21% of heart disease, and a 9-year reduction in life expectancy, will lead to a 7-fold increase in direct health costs, with wider costs to society that Foresight estimate as around £50 billion. The increase in the number of children who are obese is a particular cause for concern. Obesity is not something that children tend to grow out of. 55% of 6 to 9 year olds and 79% of 10 to 14 year olds who are obese will remain so into adulthood. There is a very real danger that significant numbers of today's children will live shorter lives than their parents and spend more of their lives in poor health. In response to the Foresight report, we launched the government's obesity strategy, Healthy Weight, Healthy Lives, in February. The strategy sets out how we could support parents and very young children with targeted advice and breastfeeding promotion schemes. How in schools and communities we would promote healthy food, and how by working with employers we would make it easier for people to build exercise into their lives. Healthy Weight, Healthy Lives is the first strategy of its kind in the world, and as Foresight pointed out, the UK is well placed to be a global leader in tackling a problem that is challenging policymakers across the globe. Obesity is the product of a simple imbalance between energy intake and energy expenditure. Because it is a lifestyle disease, it requires us to change the way we live. Low-skilled manual jobs have shrunk in the factories, in the farms, the docks and the shipyards. They are now more likely to be found in call centres and in the retail and services industry. Over the last 20 years, the number of children being driven to school has doubled. The majority of primary school pupils live less than a mile from their school, yet 41% are driven by their parents, and this figure is rising. Research shows that only 17% of parents with an obese child identify that child, their child, of having a serious weight problem. And the majority of parents overestimate the amount of exercise their child engages in and underestimates the amount of food they eat. Many are discouraged or confused by over-medicalised terminology such as BMI and the clinically obese, and they worry about the stigma that is attached to this subject. Messages about the importance of healthy living often don't reach those most at risk. The Foresight scientists highlighted the fact that for an increasing number of people, weight gain is inevitable and largely involuntary as a consequence of exposure to a modern lifestyle. They used the term passive obesity and pointed out that it particularly affects the socially and economically disadvantaged. Our strategy made clear that in approaching this problem, we reject both the nanny state, which polices shopping trolleys and institutes national exercise regimes, and the neglectful state, which wipes its hands of the problem and wags its finger in the general direction of the most vulnerable families in the vague hope that they will do as they're told. It's easy for politicians to stand on the sidelines accusing the impoverished, the fat and the excluded of only having themselves to blame. But before we evoke the Victorian notion of the deserving and undeserving poor, the very concept that Fabians have battled against over the years, we should take a moment to consider how complex these issues really are. Just as the government has a moral duty to tackle poverty and exclusion, so it also has a duty to address obesity. But this is not a license to hector and lecture people on how they should spend their lives, not least because that approach simply won't work. Tackling obesity requires a much broader partnership, not only with families but with employers, retailers, the leisure industry, and the leather industry for that matter, the media, local government and the voluntary sector. We need a national movement that will bring about a fundamental change in the way we live our lives. Earlier today I met with leaders from major health charities, retailers, the health profession and community action groups to discuss how we could form a national campaign that would help us change the way we live. I will also be writing to 220,000 local activists who are already doing excellent work in their communities to promote good health, to ask them to help shape this movement. We're calling on everyone, from the smallest community Keep Fit class to the biggest retailer in the land, to join this campaign to change the way we live our lives. Research also shows that vilifying the extremely fat doesn't make people change their behaviour. Commentators who point and shout at pictures of the morbidly obese simply fuel the problem. But if you present the message more intelligently, if you explain to parents that many children, regardless of their size, have dangerous levels of fat in their arteries or around their organs, and this may reduce their life expectancy by up to 11 years, those people will respond. The government commissioned the Foresight report because we wanted our best scientists to turn their mind to one of the most intractable problems of the developed world. In the political battle between modern science and Tory prejudice, I'm with the scientists. To follow any other path wouldn't just put our society at risk of obesity, it would put our health service at risk of decline.